Good morning, everyone. My name is Dr. Abhishek Kamath, and I will be presenting a study on clinical profile of chronic otitis media in children aged 5 to 15 years at a tertiary care hospital. So, chronic otitis media is a significant global health issue affecting over 20 million individuals worldwide. Its prevalence is notably higher in low and income countries. CSOM is characterized by chronic inflammation of the middle ear and mastoid persisting for over 2 months. This condition often leads to tympanic membrane perforation, otorrhea, and complications such as hearing loss, mastoiditis, and meningitis. CSOM typically arises from inadequately treated or recurrent otitis, acute otitis media. It is classified into two main types: benign, that is tubotympanic, with central perforation with milder outcomes, and malignant attic-entrant type with severe complications involving attic and posterior superior areas. Risk factors include malnutrition, overcrowding, poor hygiene, and recurrent upper respiratory tract infections. Misuse of antibiotics contributes to treatment challenges due to resistance. CSOM remains a leading cause of childhood hearing loss globally. The objectives of the study were to study the demographic characteristics and clinical presentations of CSOM in children aged 5 to 15 years, to determine the proportions of various types of CSOM, to evaluate management strategies to improve outcomes. Our study was cross-sectional study conducted in the Department of Otorhinolaryngology at a tertiary healthcare institute from July 2023 to June 2024. Participants were children aged 5 to 15 years diagnosed with chronic otitis media. The data collection included clinical evaluations, otoscopic examinations, and audiometric assessments. The inclusion criteria included children aged 5 to 15 years with any type of CSOM. Exclusion criteria: cases of otitis externa, traumatic tympanic membrane perforation, otosclerosis, congenital ear anomalies, congenital hearing loss, previously operated ears with recurrence, or lack of parental consent. We analyzed 45 cases. Age distribution: 21 children, that is 46.6%, were aged 5 to 10 years. 24 children, that is 53.3%, were aged 11 to were among 11 to 15 years, and among the gender, predominantly boys with a slight male predominance. Most common symptoms included hearing loss in 41 children, that is 91.1%, ear discharge in 33 children, that is 73%. Other symptoms included earache, that is 17.8%, tinnitus 11%, and vertigo 4.4%. Characteristics, distribution of children according to characteristics of discharge. Among the 45 cases, type of discharge: mucopurulent, that is 26.7%, was most common, followed by purulent, that is 22.2%, and blood stained was 13.3%. Based on amount of discharge, profuse discharge was observed in 22.2% of cases. 28.9% reported foul smelling discharge. A distribution of children COM according to otoscopic findings. Key observations included posterior superior retraction pockets in 29% of cases, tympanosclerosis with perforation in 13% of cases, cholesteatoma associated with retraction pockets in 17.7% of cases, scutum erosion in 22% cases. Distribution of the types of distribution of children according to type of chronic otitis media. The distribution of COM type was as follows: serous otitis media included 26.7%, active mucosal included 22.2%, inactive mucosal included 20%, active squamosal included 17.7%, and inactive squamosal included 13.3%. Hearing loss. Among the children, 53% had mild hearing loss, 29% had moderate hearing loss, 11% had moderately severe hearing loss, and no cases of severe hearing loss, that is greater than 70 decibel, was noted. Distribution of children according to risk factors. The most common risk factors were adenotonsillitis with 40%, rhinosinusitis 33.3%, and chronic tonsillitis with deviated nasal septum 17.7% each. Distribution of COM according to treatment. The treatments provided included tympanoplasty with 11%, modified radical mastoidectomy was advised in 17%, Grome insertion with myringotomy was advised in 22%. Other combinations of medical and surgical interventions were also advised. Here is the discussion table I had made. In my study, 53 among the demographics, 53.3% were the children aged 11 to 15 years, 46.6% were aged 5 to 10 years. In prevalence of COM, not stated explicitly when we focused on clinical profiles. Among common symptoms, hearing loss was most common. Among types of discharge, mucopurulent discharge was most common. Otoscopic findings, posterior superior retraction pockets was with 29%. Among types of COM, active mucosal type of COM was 22.2%, and serous otitis media was more, that is 26.7%. Among hearing loss, mild, that is 53% to moderate, was 29%. Among risk factors, adenotonsillitis and rhinosinusitis were included. And in management strategies, we did manage the patient more with Grome insertion with 22%, and among the complications, posterior superior retraction pocket with cholesteatoma was more commonly seen. Conclusions. Chronic otitis media is the most common in boys aged 11 to 15 years. Hearing loss and mucosal type of COM were the predominant findings. Mild to moderate conductive hearing loss was observed in majority of cases. Adenotonsillitis and rhinosinusitis were significant risk factors. Prompt diagnosis and treatment along with public health interventions were essential to mitigate the burden of pediatric COM. Thank you.
I request Dr. Vijay Kumar Kendri to hand over the certificate to Dr. Abhishek. Next, Dr. Neha Mhatre.